Okay, go ahead, Colleen. Thanks.
Okay, sorry for the delay, everyone. Patient ran long, and then Echo made me put in my credentials multiple times to get into the video today. So we are going to talk about civil commitment of patients in parenting classes, or patients involved in CPS. Let me open my PowerPoint. One second. Let's try this one more time. Oh. What are you guys able to see? Are you seeing my display, my notes?
Yeah, we can see your screen.
Yeah, we just see this. I just see the slide with the slides on the left, not your presenter mode.
What are you seeing here?
Oh,
Sorry, one more
just
time. Jay, what are you
the
seeing here?
slide with the rest of the slides on the left, not in presenter mode, presentation mode.
I don't know why it does that. Okay, I think it's because I'm in the browser, but give me just a second.
No problem.
Okay, we're gonna just minimize this. So you will see a little bit of notes. We'll make do.
Sounds good.
All right, so today we're gonna talk about civil commitment.
We don't see anything right now, Colleen. You stop sharing. Yeah.
That's not helpful.
Okay, now we just see actually your Zoom screen. So if you want to click on your PowerPoint, it might show up then.
That's my plan. How's that?
Not yet.
Okay. Jay, I'm going to give you this PowerPoint afterwards.
Sure.
And I'm going to talk through this rather than us waste time trying to figure this all out today.
Okay.
So I kind of want to talk through civil commitment in the context of CPS cases. And so this has come up a number of times when I am conducting parental fitness evaluations. I'm called by CPS worker and they say, we really think that this parent needs to be civilly committed. And so they've asked, what do? We don't know how to handle that. So it's rare, but it does come up every once in a while. And so I thought maybe giving a broad overview of what we mean by this would be really helpful. So first off, when we're talking about civil commitment, we're talking about a person being placed in an inpatient psychiatric setting because they're an imminent meaning like it's going to happen now or very, very soon, risk to harm themselves, to harm another person, or having an inability to care for themselves. And so that means, sorry, I was trying to see if the wording for West Virginia is in here. Yeah. So that means that if you have a fear that, say, a person has expressed suicidal ideation, they said that I have a plan, I have a gun, I'm going to kill myself. That is an imminent threat. They're going to do it right here and now. They have the means to do it. They have a plan to do it. That would probably meet a standard of danger to themselves or others, danger to themselves. And if they were threatening to harm identifiable others, could be a danger to others, an inability to care for themselves. And so we are going to talk about kind of how to handle those cases and what you can do. Has anybody here had that happen in any of their cases? Kristen, you're not placing anybody upstairs? Okay. Well, this isn't, let me try my I'm going to try the screen one more time. I apologize. I've got pictures to take a look at. Okay, can you see my screen? All right.
Yeah.
So what I wanted to share with this one is that when we're talking about civil commitment, we're talking about having them evaluated by or certified by an examiner, having a mental hygiene commissioner come in and order that they receive treatment. So it often becomes what we call involuntary. When they're civilly committed, they're involuntarily admitted to a psychiatric hospital. So the people who do this kind of certifying or evaluation process are individuals employed through our comprehensive community behavioral health centers. And so this map shows you where and who the community mental health centers are, comprehensives are throughout the state. So I'm located in Morgantown area. Valley is the comprehensive behavioral health center. So Valley is the ones that does all the certifying of people who are found to be civilly committable, or certification to see if a person is to be civilly committable. I'm trying to think of where we have people from today. Can you guys put in the chat what counties you're coming from? Jeanette, I know you're up in the Northern Panhandle. You're going to be Northwood as the Community Mental Health Center. So sometimes the Community Mental Health Centers, sometimes they have the location, like they're where the person will be committed as well. And sometimes they commit people and then maybe they'll come to Chestnut Ridge in Morgantown. Let's see, I got a couple in the chat. Where are people coming from? Preston County. So Preston County, you're also using Valley. Oh, geez. You're using Valley as well. We've got Raleigh County. You're looking at FMRS, Monongalia, Marion County, Ohio County, Northwood up there, Robin. And so these are the community mental health centers that are going to do the certifying process. And I want to mention them a little bit later because they are also the places where you're going to probably need to help these parents get treatment after the civil commitment process, because this civil commitment process, it's kind of like a Band-Aid. The purpose of it is to be very short term, to quickly stabilize this patient, keep them safe through the crisis, and then the patient is to be released back into the community. And so that is only going to be successful if then when they release into the community, they have the services they need to remain stable from their psychiatric illness. And so that's where these comprehensives are important, again, on the back end, to what services can they provide to keep this parent from having to be committed again in the future. One thing that seems to come up with the courts a lot is they get frustrated with a parent or a defendant with a severe mental illness, and they just want them to be in a long-term treatment facility. And I get calls on this all the time. Where can I place somebody that'll be long-term treatment for mental illness? And the answer is there aren't many places that are going to be long-term psychiatric treatment. And that's because in the 70s with deinstitutionalization, we said patients shouldn't live in hospital settings, they should be living in the community. And we've shifted everything to community-based services and really are saving our hospital beds for those who are acutely ill and not safe to be using the community-based services. So just keep in mind, this really shouldn't be a long-term solution. And some people will say, well, if I can just get them to Sharp Hospital, they're going to stay there for a long period of time. Technically, it's still an acute setting. The patient should only be there long enough to be stabilized and then discharged back into the community as well. So we'll come back to this slide about comprehensives in a little bit. So let's talk about involuntary admissions is another word that has to do with civil commitment. And so we're talking about when we're talking about it as involuntary, we mean that it's against their will. It wasn't their choice to go there. And so we talk about when they have a substance use disorder, a severe mental illness, substance withdrawal that gets a little iffy, and they're likely to cause serious harm to self or others. And so you're going to hear a lot of words that are kind of strange because they're strange to me. I even looked it up. I always hear file a petition for a mental hygiene warrant. That's the wording that I often hear. And so I'm over here trying to search petition for mental hygiene warrant in West Virginia. And the word is actually application. So if you, as the worker, think that a parent needs to be civilly committed due to danger to themselves or others, or an inability to care for themselves due to a severe mental illness, then you can make an application for involuntary hospitalization. This can come from any adult person. As you see here, this comes from the code, and I don't believe it's changed. The code was recently updated. I don't believe this has changed. But any adult person can make that application. It's an application to have them examined to see if they meet criteria to be civilly committed. And the person making the application, the only criteria to make that application is that that adult has a reason to believe the individual that needs to be examined, or say the parent in your CPS case, this says has a substance use disorder as defined by the DSM. That's our criteria for mental illness. And that can include substance use withdrawal, or the person has a mental illness. And because of the substance use disorder or mental illness, they're likely to cause imminent harm, serious harm to themselves or to others if they remain at liberty. So this means if they stay in the community, if they're out on their own, they're likely to cause harm to themselves or others while they're getting this examination and certification. And then we'll talk about, it's not, this has changed, this last line. So we'll talk about that in a minute. So big long text coming straight out of West Virginia code. If people are really interested, it's a really long document and it's a bit confusing. But all of this comes out of West Virginia code section 27.5. And these definitions is 2. So 27.5.2 will give you all of this information. This is taken straight from that. So you, as the worker involved in this case, can complete an application, which simply says that you have reason to believe that this person has a severe mental illness and is a danger to self or others. And I'm gonna show you the application so you can see where to get it from and you can see what it looks like. This does not have to be a mental health provider that completes this application, and really probably it isn't necessary to be. This can be family can make this application. Oftentimes you'll hear, we'll have the family file a petition against this person. So if you hear the word petition, you're also going to think application. They're the same thing in the state of West Virginia. That's the state of North Carolina. That's not helpful. Give me just 1 second. West Virginia application for So the West Virginia Judiciary, because this becomes a legal process, has all their forms on the website. The one that you're looking to fill out yourselves is this application for involuntary custody. Now it's gone away. Application for involuntary custody for mental health examination. So all you are saying is, I have some reason to believe that this person needs to be evaluated by a mental health provider to determine and then taken in front of a mental hygiene commissioner to see if they should be involuntarily committed. Okay, so you're filling out the application. It gives you instructions. I think it'll be helpful if we kind of talk through some of this, make it a little less, I don't know what this looks like, I don't know what this says. So you're going to fill out as much information as you know about this person or that you have. You can attach any documents that you might need. This is basically if law enforcement has to go and pick this person up from a location, they want to know what the person looks like, right? They want to know who they're picking up. So their name, their date of birth, weight, hair color, hair length. That's to help them find and locate this person. So the respondent here is the parent. Respondent is the person that you are concerned is at risk to harm themselves or others. What's their last known address? What's their phone number? Those are informations you usually have in your case files. Where were they born? You may or may not have that. Where are they now? So if they were in an office with you, or you know that they're in X location, you can provide directions. You can provide where there are residents, what county they're resident in, and what county they're currently presenting in. So it's my understanding that the county that they're in is where you're filing the paperwork, but they may be a resident of a different county. So applicant, it says here to help you out. Applicant means you're making the application, you're the applicant. Respondent is the parent that you're worried about, or other adult that you're worried about. And then walks you right through it. So they want you to provide a way to contact them pending the application process. They must be able, the court must be able to reach you during this process. The hearing will be held as soon as possible after the respondent is detained. So you fill this out. Law enforcement is going to pick this person up. They're then going to get certified by an examiner who says, yes, this person meets criteria for civil commitment, or no, they don't. Then there will be a hearing held in front of the court as soon as possible. And there are like specific timelines. The goal is like within 2 hours, the person is going to have a hearing. And they said if, the applicant needs to be present, if possible. And then it talks about how your relationship is. Okay, so this is those main questions, right? Do you believe that the person is addicted to drugs, alcohol, or other substances? Yes or no? And then it wants an explanation. And the best things you can do is state the things that you've seen, the things that you know, things that you've heard. You may have to, may be able to put documents in here. You'd have to talk to your supervisors or powers above about whether you can put in information from your investigations. So are they addicted to drugs, and or are they mentally ill? And then after that, do you believe that because they are mentally ill, and this could even be like, you just need some reason to believe. So I think they're mentally ill because they're talking about these little green aliens invading the house. I mean, you don't have to lay out the criteria for what diagnosis they have. That's not expected of you as an applicant. You're simply giving some idea of what that examiner is going to be looking for. And why do you think they're likely to cause serious harm to themselves? They're talking about green men, they're hiding, they're talking about being suicidal. Maybe it's that you're worried that they're going to harm somebody else. So you may say they think they see these little green men. They've stated these little green men tell them that they need to shoot the next person that comes to the door, that kind of information. Then it tells you to list any and all recent acts that support this belief that they're likely to cause serious harm, including dates. And remember, that's because we're looking at imminent risk. We're looking at what's happened here and now. We're not looking at acts. So up here where you say, I think that they have a mental illness, you might say they were diagnosed 25 years ago. They've been hospitalized 15 times for this diagnosis. But down here, you're going to say, but today they told me X, or today this happened, or I observed this behavior. So that's when you talk about, it needs to be kind of like, what are they doing right now that says, yes, they're going to be a harm to themselves or others? And then you let them know, do you think they're a risk for suicide, or do you think they're a risk for homicide? And are they in possession of a weapon? This is protecting your law enforcement officers that are going to go out and pick them up. And then are there other people that can kind of verify this information? And if you wanted those people to appear at the hearing, you have to kind of let them know. So say the mother told you this information about the father, you think the mother should be here for the hearing, it's telling you to let them know. If they're currently hospitalized, so this might mean maybe they're at Ruby right now because they have a cut on their arm and they're getting stitches. This is letting them know, okay, they're in the hospital, but they're only in the hospital for this physical issue and they might not stay there more than 25 minutes. Have they been under a recent care of a physician? This helps us get records and see what's going on. Are they in need of medical care? Are they taking any medications? If you don't have the answers, you don't have the answers, but as much information as you possibly can. And do they need anything that would stop them from immediately getting a mental health provider to do an evaluation? As you can see, the questionnaire goes on. So the next thing, these are important notes because it's saying, have they ever been diagnosed with an intellectual disability or developmental disability, dementia, epilepsy, traumatic brain injury? And that's because if these alone are the diagnoses the person has, this excludes them from being civilly committed. So if the person solely has an intellectual disability, and so they're IDD and they have no other mental illness, legally they're not allowed to be civilly committed. If it's dementia alone, they're not allowed to be civilly committed. So check the boxes that are appropriate here. If it's intellectual disability and an impulse control disorder, or schizophrenia and dementia and there's psychotic symptoms, those are all reasons that a person can be committed because they have that severe mental illness piece. It's when it's just epilepsy, it's just dementia, it's just an intellectual disability that we are not allowed to civilly commit them. But again, those are diagnoses. So that is on the examiner to make those determinations. You're just helping them to gather that information. Have they been examined? And so this might be helpful because maybe you attempted to get them civilly committed in Ohio County and it was denied. And then but now the person has left and they're in Hancock County and they're making threats and they're concerned. And now you're filing it in Hancock County. You kind of want to let the courts know there was just another one. It was in Ohio County and it wasn't successful. And then any guardianship information or spouse, next of kin information for the respondent, so the parent that you're worried about. And have they been offered voluntary treatment? Have they refused it? And is there concern about their inability to consent to it? And this is just indicating, some things to keep in mind. Again, if you're making an application in good faith that you have reason to believe this person is mentally ill, these things shouldn't be a problem. And then basically you're just attesting that you believe that this person suffers from a substance use and or mental illness that's likely to cause serious harm to themselves or others. And then this is that part. If you're maliciously filing an application against somebody, that is a crime. And that you're swearing to tell the truth under penalty of law, and then you sign it. Questions on this application? And I will make sure that Jay gets a copy of this PDF document that you can take with you. All right. I'm going to keep moving. So again, we talked about this, but dementia, epilepsy, and intellectual disability alone are not reasons to have a person civilly committed. However, if there are other symptoms of a mental illness that are as well as these disorders, then that person would be civilly committed because of those other illnesses. Here's the link to the mental hygiene. It's going to be in the PowerPoint for you. This is the sheet that we just went through. So it's under oath. The applicant, so the person filing it out, should be available for a hearing within 24 hours. I think the time frames have even shortened more than that. And so voluntary, so asking the parent, would you like to sign yourself into the hospital? That should be the first option, right? We should always be trying to see if they will do this voluntarily. And it's if they won't do it voluntarily that we file the application against the person. And then this just talks about if you filed maliciously against somebody, it's a fine or up to 1 year in prison. 1 year in prison. So this is a little confusing, but we're going to start all the way down here at the bottom. It probably would go a lot better if I could play the slides for you. But first, an application is made. So again, that's by any adult can make that application. And so then there's a judicial officer review, and they can deny the application, or they can accept the application. My guess is that with enough information, the applications are usually going to get accepted. Then the person is detained and an examination by a mental health professional is ordered. And that mental health professional, and I'm going to show you the forms that they use the word is certify the individual. And so I'm going to show you the form they use and the information that they're gathering to certify. And so that mental health examiner's opinion will be, yes, it's consistent with that application. They are likely to cause harm. Or it's not consistent, or they're not likely to cause harm. It doesn't meet that criteria for civil commitment. And if so, then it's denied. The civil commitment's denied. The person is released. They're free to go. If they are likely to cause harm to themselves or others, then they go to this hearing. This probable cause hearing is when the mental hygiene commissioner takes all of the information. This is the hearing the applicant may need to be present at to help provide evidence for the civil commitment of that individual. So then it's a little bit different if the person's in the emergency department. So one of the things that you all could do if you've got a parent is have them go to the emergency room and have them be evaluated in the emergency department. So if they present to the emergency department, a physician will examine them. It says physician. It's a mental health professional, and there's a lot. Mid-levels can do it. Social workers can do it. Psychologists can do it. There's a lot of people that have the ability to certify. Basically, it's people who have the qualifications to make this diagnosis and judge whether they're a harm to themselves or others. And then a person meets criteria for an application. They can hold them for up to 72 hours kind of in the ED for psychiatric or medical treatment. And they file that application, and they've already filed this application. And then you go back to that process that we talked about before. This is the same one we talked about. Okay, so we get to the probable cause hearing. There's the mental hygiene commissioner reviews all of the evidence. He reviews the application. He reviews the certification by the mental health professional. He can take statements. There are attorneys on both sides. A probable cause hearing, they can find probable cause found. That means the person is found to be civilly committed, or probable cause is not found, meaning the person is not civilly committed. If not civilly committed, they're released and go back on the streets. If probable cause is found, they are then ordered to treatment in the least restrictive setting. So that 9 times out of 10 means involuntary hospitalization. However, if they can be treated in an outpatient treatment setting under conditions that they have to fulfill, they could go into an outpatient treatment program. I wish I had some numbers for you, but I think this is used a lot less often. Remember, you can civilly commit based on that substance use disorder. And so I think this is where, if they had agreed to outpatient treatment or maybe like an intensive outpatient program, like an IOP, maybe they could be kind of involuntarily committed to this outpatient program. 9 times out of 10, they're going into the hospital because they're a danger to themselves or others. And one way that we protect them and the community is by securing them in a facility. Sorry. So if they are going the outpatient treatment route, do they have a history of involuntary commitment in the past 2 years? If so, they can have this voluntary agreement. And if they haven't been involuntarily committed before, they can have it for a shorter period of time. It just kind of lays out the requirements of that. And you'll get a copy of this. But 9 times out of 10, they're being involuntarily hospitalized. And so they go into the hospital. Within 3 days of being in the hospital, if they're not ready to discharge, the hospital has to certify that there's a continued need for them to remain there. And then if there's still need after 10 days of hospitalization, then we talk about a final commitment proceeding, which is a bunch more paperwork. And basically these are safeguards so that hospitals don't keep patients indefinitely. The goal is that you could stabilize this patient. Hopefully they could be discharged within 3 to 5 days. But if we're getting all the way to 10 days, then the court wants to know, then the court wants to be able to make a determination. Okay, I agree you can continue to keep them hold them involuntarily or not, but it's a safeguard to the patient to not get stuck in a hospital setting. So let me show you. And there's also applications for mental health examinations of minors. I think that's if they're in a hospital setting. It's a different situation. If they're minors, DHHR has control. DHHR can have them placed in a facility. So it becomes a different process. So the other one I want everybody to look at though is when that mental health provider evaluates them, they call it a certificate. They may call them examiners, not to be confused with like forensic evaluators. This is kind of a completely different, separate process. And so this is where the community behavioral health centers come back into play, because each of those community mental health centers has certifiers. And there could be other certifiers, but they have certifiers that will do this process. So they get notified when an application has been filed or it's been accepted, and then they have a certain period of time in which they need to see the person and evaluate them. And it's kind of a bit similar to the application, but again, this is, and they tell you here, the name of, it can be a physician, a psychologist, and then the court can authorize certain other providers. So if the court has already authorized these people as certifiers, in licensed independent clinical social worker, court authorized licensed advanced nurse practitioner with psychiatric certification, physician assistant, or licensed professional counselor. So they have personally observed and examined the respondent. They provide all that information, last known address. This is all that kind of stuff that's coming from your application, right? And then they say, I find reason to believe that they do have a mental illness. Check. Maybe they have a substance use disorder too. Check. Or we say they don't have a mental illness. They don't have a substance use disorder. And then it says, if the individual is being certified for a substance use disorder, initial the following. I recommend the individual be closely monitored because there's reasonable likelihood for withdrawal and detox that could cause significant medical complications. For example, if somebody has heavily been drinking, alcohol withdrawals can be life-threatening. And so this is a box to check if they're coming down off alcohol and they need to be monitored, and some other substances as well definitely need to be monitored during withdrawals, not just because withdrawals are going to be terrible for the person and feel awful, but because it could be a danger to their health. And so they further find that this person is or is not likely to cause harm to self or others due to mental illness. So this is that place where they're either certifying yes or certifying no. If they certify no, the person's not civilly committed. If they certify yes, it goes to that next step in the process. And then they say if they are likely to cause harm, then they have them describe, have they inflicted or attempted to inflict bodily harm on another person? So then this is different. This is the forensic population that I work with. 276A is our forensic code. And if they're already in a state psychiatric hospital, we go through another set of factors. So you're likely to ignore this one. By threat or action, have they placed others reasonably in fear of physical harm? Have they placed others in danger that are in his or her care? Have they attempted suicide? And then this is kind of that last one. Have they acted in a manner that they're unable without supervision and assistance to satisfy their own needs, nourishment, medical care, shelter, self-protection, safety, so that in such a way that they are likely to die or receive a severe bodily injury from it. So again, this person is homeless, but because of their mental illness, but it's that this person can't care for themselves. They can't take their medication. Maybe they have medical problems. If they don't get their medication, they're likely to be seriously injured or die. Then this is that inability to care for themselves portion. And then this is substance use. And so this is within 30 days of the application. They talk about what issues substance use has played. So that it's not just that any substance use disorder would be enough to get somebody civilly committed. But again, because of their substance use disorder, are they at harm to self or others? And this kind of breaks all those down a little bit more carefully. And it's encouraged that there's collateral sources contacted. So did they talk to the respondent? Did they talk to, it says petitioner, that's you guys as the applicant, they providing the application. Did we look at a medical record? Did we talk to another provider? Did we talk to family members? And then what symptoms of their mental illness or substance use did the examiner, that mental health provider, actually observe? And we're still going because this is a long form. So they're talking about a history of mental illness. So they really need to do a pretty thorough evaluation of this person. History of mental illness. Are there less restrictive alternatives that are not appropriate? Meds that they're currently taking. Is medical clearance examination necessary? It could be yes, could be no, could be unknown. That was a whole debacle, medical clearance. And then you're giving more specific information. The thoughts of suicide, was it just ideation? Was there a plan? Was there intent? All those questions. Do they have a head injury? Do they have a history of legal problems? What drugs are they using? This is to get more at like, what is the harm to themselves if they continue to use substances and they aren't in a controlled setting? What's a diagnostic impression? What is your rating for their treatment needs? And then what does the certifier, what's their opinion? Should be not currently committed, should be committed for a period not to excess 90 days. That's not what we're doing here. They're really looking at should be committed for further evaluation. So probable cause hearings, this is the normal one. We check this box and it goes to the next step. Or they don't require hospitalization. And then that's their, like, I promise what I'm saying is the truth. Questions on what the certifiers are doing? No. Okay. So I'm going to stop sharing. Oh, no, I'm going to go back up to our Community Mental Health Center slide. So I guess the question now for everyone on this call is, okay, so I have a parent, they are civilly committed, they're in the hospital for 3 to 5 days, they get stabilized on medications, and they're released. What do I do now? Because yes, I've acutely stabilized them to keep them from harming themselves or others, but I still have this parent with a history of mental illness who may or may not stay on their medication, may or may not comply with treatment, and I'm trying to do an improvement period so that their kids can be returned to them. And so the inpatient hospitalization may be necessary for that short period of time, but the follow through afterwards is equally as important. And the hospital will do some of this work. They'll set up, follow-up appointments and so forth. But I think it's important as CPS workers that you can guide or tell them about some of the options. So the comprehensives all have different kind of levels of care. And we're always talking about systems of care within DHHR. And then, of course, there's kind of private institutions outside of that. So some options for people that have just come out of hospitalization, they should have a psychiatric, and it would be awesome if they had a therapy appointment set up pretty quickly, but sometimes that's difficult. Things to think about are kind of higher levels of care than just like once every month or once every 2 weeks in outpatient therapy or med management once every 3 months. We have services in the state like ACT, Assertive Community Treatment Programs. They're in many of our community mental health centers. ACT services, a person lives in the community, but they're supported in their homes by mental health providers. So a whole team works together. They go into their home and assess them multiple times a week. They can go in and like set up their medications for them. Sometimes they'll see them take their medications if that's a concern. The providers actually go into their homes. They can also get them to their services back and forth to therapy and those things if transportation's an issue. Another type of service is community engagement specialist. And so the CES services, it's case management, but it's helping them get what they need. So maybe they need help finding stable housing, filling out HUD applications, getting to the grocery store, getting to doctor's appointments. CES can help them with all those services. And then, if it's a substance use issue, maybe they've gone somewhere and they've been detoxed and now they're released. There's different levels of care. You can have medication assisted treatment programs. You could have intensive outpatient programs. So those are multiple times a week. They go in for like a couple hour-long sessions for substance use. That those can also be run by these community mental health centers. If the person needs a group home, if they need supported housing, those are very, very hard to get, but those would come through the comprehensive behavioral health centers. So your comprehensives in your area are kind of key to help you get the services or help you empower these parents to get the services they need for their mental health and substance use issues. Questions? I'm going to stop sharing.
Thanks, Colleen, for all the info. Again, reminder that we'll be sending all the information out, the PowerPoint and the attached documents, so you'll have time to review that. But yeah, does anybody have any questions? Feel free to unmute or use the chat.
Hey, this is Deb from Disability Rights. I was wondering, how much variability do you see between different counties in terms of what applications are accepted and what the outcomes are?
I believe that there's quite a bit. So actually last week I had a call with like 25 of the county's sheriff's departments because mental hygiene becomes a big issue with the sheriff's departments, because when you fill out that application, they go pick up that person. They then have custody of that person until they get them to whatever hospital they're going to. And that can be hours and hours and hours. They might have to travel across the entire state. It's using up our law enforcement. It's really stretching our law enforcement very thin. And Deb, what they were saying is that it's very dependent on county. One of the bigger counties, I'm not sure, Kanawha or Cabell, one of those down south counties, They said that there were like 400 applications made this year so far, but only 200 of them had been certified. So 400 people or times people tried to get somebody civilly committed, and only half of those times was it actually successful. So, and they said, and so I asked, is that due to the mental hygiene commissioners? Because they're all different. They all have different levels of understanding of mental illness, and they kind of like evaluators do. They all have a different threshold that they're looking at. So what they might see as imminent threat to harm self or others might be different than what I see as imminent threat to harm self or others. And these law enforcement said that they believed it wasn't a difference of mental hygiene. It was that a lot of people are trying to civilly commit family members solely due to a substance use disorder, and that our mental hygiene commissioners are really trying to kind of slow that process down, which is good, but we're using law enforcement to do that. And that's a concern. Now, Deb, there's also other counties where they're saying people are certifying people with solely dementia or solely an intellectual disability. So we do know there are some inappropriate certifications going on. And I think your agency and others are trying to shed light and make some changes when that does occur. There's a lot of mental hygienes, a lot of petitions throughout the year. The one data that I was hoping to show you today, and I didn't get around to getting it, I'm working on creating a kind of a slide like this, or a list of all the inpatient psychiatric hospital facilities in the state, because I think it would be helpful to see how many we have in all these different counties, because we are, unfortunately, we've lost a lot of beds for civil commitment. So unfortunately, I think we're going to see either people getting certified and not having a bed anywhere, or not getting certified because I think it's a reflection of the lack of resources. The people who get stuck in the psychiatric hospitals, oftentimes it's because we've got no safe place to discharge them to. So that's, again, something that the state is working on, but it is currently a problem. Deb, did that answer your question?
It does. Thanks very much.
And if there are issues, so in Deb's work with disability rights, or in anybody else's work, if you are just coming up against barriers, either people inappropriately certifying or not certifying when they should be certified, and it starts to become a pattern, either with a certifier, with the mental hygiene commissioner, with a county, those are issues that that should be addressed at kind of a state level and a higher up level. And I'm willing to get people to the people they need to talk to kind of help that process. I mean, I can tell you Harrison County, from everything that I hear, it's impossible to get somebody civilly committed in Harrison County. So there are counties like that where I don't know why that is. Maybe it's just the threshold of risk that the mental hygiene commissioners are willing to take. Questions? So my job as a statewide forensic coordinator does not necessarily involve civil commitment, although we kind of get looped into these conversations because it's my belief that patients who are not being civilly committed end up back, if they're consistently getting denied for civil commitment, but they do need to be in a hospital setting. Unfortunately, what happens is they commit some sort of crime, or they obstruct a police officer, they become forensics, and then they end up in the system in that way. And so if we're not doing the right things as far as mental hygiene and involuntary civil commitment, then we're hurting all of our systems. They're all kind of getting backed up. But please reach out if you have questions. If you come across a CPS case, APS case, whatever the case may be, we can try to help the best we can. You guys are a quiet bunch.
Thanks, Colleen. It was a lot of information, a lot of good information. We'll make sure to get it out to everybody. It's also being recorded, so you'll have that at your disposal. We just have a couple of minutes. I wanted to just make a couple of announcements. The first is We have scheduled out the rest of the year, all the sessions, so through December. You will be getting that schedule in the recap email as an attachment. You will also be getting updated calendar invites. I know there have been issues with Zoom as far as having you register again and doing it multiple times. That is a WVU issue network thing. I'm not, so we're working on it, but it's happening to me and I'm in the network. I don't understand it. So we'll get that figured out, but you'll get updated calendar invites with the rest of the dates. Of note, the one in September will be on the 4th Wednesday due to a conference. That's Kristen Boyce is going to be doing the talk. So that's the 27th of September, same time at 10 a.m., just a week later due to some scheduling conflicts. So all that information will come out, but just wanted to give you a heads up on that. If there are issues moving forward with Zoom, meaning you've registered 80 times and it's still not letting you on, please let me know. We're trying to build a case if you are to IT about this issue. We've had it across Echoes where we've had to do this. So we apologize for that. We're glad you can at least get on after so many attempts, but we're working on that. Any questions before we wrap up?
And if anybody has topics that they're interested in, questions that keep coming up in your work that we can work to find somebody to provide some guidance or help, we'd love to hear it, and we'd love to see cases.
Yes, absolutely. A case can be a question. So anything, we appreciate it. All right, we will see you then in a month here on the 27th. All right, take care, everybody.